In our view, folks working behavioral health are really outnumbered right now. And we're going to have to develop, again, the peer support groups that give some assistance to each other, as well as the peer support specialists as well. We need to expand that workforce group.
There is a big need in our community for building up our behavioral health professional workforce. In this month's local Alcohol and Drug Planning Committee meeting, we heard from Peter Buckley and John King on special programs that were designed to help train people to fill that need as quickly as possible.
I tried to chart out what's going on in terms of behavioral health efforts in the region, starting off with workforce. The focus for the workforce group is expanding the behavioral health workforce. The different programs include the SAU MicroCredential that John will talk about. On Track, and Eddie Wallace is here on the call, and he could give you more information on Track's training program that their federal grant fund is helping them do. And then the Rogue Workforce Partnership.
Can you go take us to like the 30,000 foot view about how these efforts kind of came about and where they're kind of couched from an organizational standpoint as far as the work you're doing and the work you're doing with John? I
think most of you are familiar with Southern Oregon Success. We're a collaboration of all levels of education and healthcare and human services and public safety and workforce development in Jackson, Josephine. We've done work over the past couple of years to really focus on what our regional goal is of our network. We have 68 different partner organizations in the network, all the school districts, early learning folks, RCC, SOU, All Care, Jackson Care Connects, and our pediatrics, et cetera. So what are we going to focus this collaboration on? The network agreed on a goal that by 2025, all parents and caregivers in Jackson and Josephine County will have the knowledge, skills, connection, and support needed for all their children to enter kindergarten ready to thrive. In pursuing that goal, we went through a process of identifying what are the critical shifts that would have to happen in order to accomplish that goal. From the definition of those critical shifts came the beginnings of several work groups to focus on different parts of helping us to reach that goal. One work group, for instance, is looking at how do we increase social connections as a way to make sure parents have information. Another work group is working on getting out information. We have a parenting guide called Help That Helps. So that's the context where this work comes out of, is this overall network work to achieve that goal. Out of the critical shifts identified, behavioral health workforce was identified very quickly. We need to have an expanded behavioral health workforce, not only for in the education side, everything's going to happen with early childhood, but we also have to have it for K-12, and then we have to have it for the community at large too. All the different organizations working behavioral health. In our view, folks working behavioral health are really outnumbered right now. And we're going to have to develop, again, the peer support groups that give some assistance to each other, as well as the peer support specialists as well. We need to expand that workforce group.
So what I'm going to share is this concept of a micro-credential, which is new to many of us in higher education. It may be new to you as workforce partners and such. So I'll just kind of share the lay of the land there a little bit. But essentially saying that, the intention here is to, really work on, collaboratively on the workforce development piece of this, so that we're training new staff members and practitioners, but also helping train up existing workforce, staff to be skilled practitioners to support all this fantastic work that Peter's queued up. So the first component, that is what was not funded at this point in time, but that we're going to continue working on in a couple of ways, is this idea of a career ladder that helps address the higher rungs of intervention specialists, therapeutic services in schools, all the way up through a school psychologist, right? That's a long-term goal, but what we've been working on are incentives and supports that help existing workforce progress up through that in incentivized, supported ways. So the micro-credential program specifically is designed to address that first rung of a career ladder, of upskilling people who are currently working with students and families whether in school settings or in agency settings, that don't yet have those advanced specializations or degrees that are necessarily to provide more individualized or therapeutic supports. And so within that, looking at in school settings, it would be paraprofessionals, educational assistants, classroom classified staff, school bus drivers. And so in your own agencies, maybe you think of again, those frontline staff who might be kind of somewhat parallel to that are having frequent interactions with students and families without necessarily the training to be as effective in those brief interactions as they have. So what the MicroCredential has done is identified key common competencies across those different positions that schools have piloted for those classified staff and paraprofessionals that they found extremely effective, but don't have anywhere near enough people to fill. And so we're thinking about things like skills trainers, youth advocates, family advocates, graduation coaches. There's a whole constellation of those type of kind of intermediate advanced paraprofessional roles that have some common elements to them. And so the common elements within school settings are these behavioral support competencies listed on the left-hand side of that column. And then second of all, culturally responsive and trauma-informed competencies that are critical for working with any students, children, and families. So what a MicroCredential does is bundle that into an affordable, accessible, shared delivery system for those paraprofessionals. And we've taken what would have been a series of courses leading up to a degree in counseling or psychology or what have you, and modularize those into small 1-credit workshops that we're actually funding through grants. And so they're at this point in time free for participants working through these, taking a collection of professional development workshops that are already taking place throughout the region. And what the MicroCredential does is say, well, we'll tack on the ability to earn academic credit for that. That is at this point free. If grants run out, it's still offered at a professional development rate, which is $60 per credit at a vastly reduced rate. And have those result in a MicroCredential, which is simply a badge of essentially certifies completion of 12 credits of that work that are aligned with those competencies. And so, we can be reasonably confident that these people now who have completed that are more skilled in their current roles and better equipped to perform, culturally responsive and behavioral supportive type of support for students and families. And then those credits also become an on-ramp for any of those staff who end up wanting to pursue an eventual degree in psychology and counseling and human services and education and teacher preparation, right? So it's serving those two purposes, but it's launching people into that the first rungs of that career ladder.
It is exciting when we look at all the different ways that we are looking to develop new practitioners in these fields. And, also worth noting is our need to make sure that we preserve, protect, promote, and build resiliency in the folks who are doing this work. So they go hand in hand for sure.